Hello, everyone. Thank you so much for joining us today. We are very excited to be welcoming a special guest to our cherry tree practice today. We are thrilled that we have Dr. Carly King joining us today. Dr. Carly has been a trusted go-to healthcare professional in our circle of care, and we have really enjoyed working with her collaboratively over the years on professional projects and the invaluable support that she has also provided on a personal level. Um, Dr. Carly has supported me for years with my healthcare journeys and challenges, and my families, my kids have seen her. She's a wonderful, skilled professional that we have right here in Dundas working at the Health Center for Integrative Therapies. And we invited Dr. Carly on today to join us to chat a little bit about our clinical theme and topic this month, which is seasonal affective disorder and seasonal mood changes. And we asked, and she said yes, and we're thrilled that she's here. And we want to give a great big warm welcome to Dr. Carly. Hi, Dr. Carly.
Hi, Cree. Thank you so much for having me on today.
Thank you so much for joining us. We're so happy that you're here. And Dr. Carly, we just took a few questions from the clients that we work with. We largely work with women's wellness topics and the women's population. And something that we've noticed comes up a lot, especially around this time of year, is changes in mood. And we recently put a poll out there on our Instagram account, and we asked our audience, do you notice seasonal mood changes this month? And the results were a resounding yes, with over 80% of the participants polled saying yes, they do notice a difference in mood this month. And so we're really interested in sort of picking your brain a little bit and your expertise around this topic. And especially kind of starting out with, how do we know what the difference is, let's say, between seasonal affective disorder, which is, of course, more of a serious clinical condition and diagnosis, versus more common seasonal mood changes? Could you tell us a little bit about how to differentiate the two?
Of course. So that's a great question, Cree. I love that you put that on Instagram. That's a cool poll to put out there and see where people are at. And so, seasonal affective disorder, or SAD, is a type of depression that happens with a change of seasons. And so, for most people, you'll see that that can happen with these darker, colder days through fall and winter. It can happen for some through spring and summer season as well, but it is less common to see that. And so a lot of us do have a little bit of that winter blues as kind of shift into the season, right? I know I feel it. I know, especially if you have young kids, maybe your sleep schedule is changing with the time change as well. And so it is a little bit challenging to transition for a lot of people. With regards to seasonal affective disorder, it is a much deeper, more profound depression that you're going to experience for most of the day, for most days, and it doesn't typically subside. And so, once we see that level of depression there, we do want to be taking that more seriously and touching base with a healthcare provider to make sure that we are following up there on treatment plans.
Okay, that makes sense. Thank you so much. I think that
Mhm.
description is really, really helpful. Whether we're kind of noticing more common fluctuations in mood given the time change, and as you mentioned, everything that's going on in November, particularly this year in 2021,
Mhm.
with all of the many global challenges that we're facing and individual challenges, versus the more sort of serious seasonal affective disorder, where we might need some more targeted support and interventions.
Of course, yes.
Okay, thank you. So maybe you can give us an idea of what some of those common symptoms are. You had mentioned sort of the duration and the frequency.
Mhm.
What do we need to kind of be looking for in terms of mood getting worse or depression
Mhm.
setting in?
Yeah, that's a great question, Chris. So, the depression is definitely one of the key factors that we're looking at. And so, for a lot of women, I'll say women because I work with mostly women as well, we do see that mood can take a pretty significant shift pretty sharply with the onset of that change in season. And once we get there, you can see a lot of the typical symptoms of depression where mood is low, but you also may find that you're more irritable, more agitated throughout the day, more short in general, short tempered, and it feels hard to be there. So, feelings of hopelessness, feelings of guilt can come into play there as well. We also will typically see some of the similarities that cross over into other forms of depression, like changes in sleep patterns. And so, we can see either insomnia or more commonly with winter sad is actually oversleeping or feeling like you need more sleep than you typically do. And so we will see that that can affect daytime energy levels as well. You can see that you may feel more fatigued, more lethargic than you typically do as well. And then we can also see that eating patterns can change too. And so this could be under eating, but this also more commonly, again, with winter sad is overeating and especially having more cravings for really high carbohydrate rich foods. And so we can see weight changes come there as well. Weight gain is very common with winter sad. And so we want to kind of look at the collective of all of these symptoms coming into play. I mean, a lot of us like cookies and whatever baked goods that come in through winter time,
Right.
which is great and part of the holidays as well. But we want to think about the collective of all of those different symptoms coming into play and that they're feeling unmanageable to you. And so if you're in this place where you're creeping into that hopelessness or that despair, or even feeling more serious symptoms of self harm potentially, these are things that we really want to pay attention to. And they're big red flags that we should be getting some help, reaching out to a healthcare provider, that there's a little bit more going on there than just this mild winter blues as we transition into these colder, darker months.
Okay, okay, thank you. So if things are getting worse, if the mood decline is progressing, if we're noticing those symptoms that you mentioned really declining and intensifying, and not really letting up, not lifting or resolving, that would be a
Yes.
good time to and
Yes,
reach out to our
exactly.
circle of support, and healthcare professionals in that circle, and go through some perhaps screening measures, to check in a little bit, a little bit more significantly about what's going on, and maybe to make a treatment plan.
Yes,
Right.
exactly.
Yes.
Mhm.
And I wanted to ask you as well, Dr. Carly, is it true that women tend to be more affected by seasonal mood changes and or seasonal affective disorder than men are?
We do typically see that women are more prone to seasonal affective disorders. We actually do see that for quite a lot of mood disorders, that women are more predominantly affected. And so, again, I'm biased because I do treat mostly women,
So do
but
we.
yeah, I mean, there's a lot of extra factors with women, right? I mean, we have a lot of different hormones cycling all the time that men don't have. And so for men, hormones are kind of always baseline. They don't fluctuate a whole lot. Whereas for women, they do. We're on a monthly cycle. Even once you're done cycling, there is a little bit more of this up and down. And so that always plays a role with women's health on top of whatever else is going on with seasonal shifts or life shifts. And so we always have that extra influencing factor there as well.
Yes. Okay. Thank you. And of course, we
Mhm.
don't want to leave men out. We did have men
Mhm.
respond to our poll, or people
Right.
identifying as male, and had noticed they were part of that 80%. They had noticed
Mm.
these shifts too. In our practice, we do work with a lot of women in our community and a lot of women in the perinatal population, which of course has a vulnerability, attached to it as well. It's a fragile time. It can be a very vulnerable time. And so it's important. I love what you said about kind of looking at everything in context, right? And
Yes.
seeing what's going on. So if folks are sort of experiencing more of the seasonal mood changes and not so much a declining or drastic depression, but more of, kind of that irritability or exhaustion or fatigue that you mentioned, sometimes motivation can be lower. It can be tough to kind of stay focused or concentrating on our work or things that need to be done at home. This is kind of a lot of what comes up with our
Mhm.
clients at this time of year. What's the best way to sort of manage? What do we need to know to kind of manage our wellness around those
Mhm.
seasonal shifts? What's important for us to do right now, especially heading into the holidays next month?
Yeah, that's a great question, Crayon. So I think a lot of what we can do for seasonal affective disorder is also relevant for some of those more mild winter blues, where we are still experiencing some of those symptoms without necessarily the same degree that we'll see with SAD. We can definitely pull in some of those tools still. And so one of the best evidence treatments for seasonal affective mood disorders is using light therapy to regain some of that exposure to the light that we're lacking a little bit through the cooler months. And so there's a couple ways to do this. If it's manageable with your schedule, one of the easiest ways to get some of that exposure first thing in the morning, ideally, is to open all your blinds, all your windows. If you have coffee or a tea in the morning, sitting in the sunlight early on, and so, if that's an option with your schedule, that's a great way to do it. Even stepping outside for a couple of minutes, getting some of that sunrise around 7:15 in the morning right now. And so, if that works for you, that's a great way to do it. If you have a little bit more time in the morning, getting out for some early morning exercise, going for a walk with that early morning sunlight can be a really great way to get that exposure from the light that we do see is beneficial for helping to shift that mood piece. If that's not a possibility, and for a lot of people it isn't because we're leaving early for work in the morning and we may miss that window, you can look at investing in a light therapy box. And so there are what we call happy lights available that can kind of mimic the same thing. And so for most of the research, we're looking at sitting with the exposure, and same thing, you could have your coffee or tea in the morning and put your light box on the table and have that exposure for about 20 minutes in the morning to again mimic that sunlight that we're missing, that really seems to be a key player for some of these seasonal mood disorders. There's another cool tool that we can use as well that is actually an alarm clock that mimics the sun. So the sunrise in the morning. And so over the course of about half an hour, it will gradually increase the light in your room to mimic the sunrise as well. And this is a great tool that a lot of people find effective for helping to shift that mood and make it a little bit easier to get up in the morning when it's so dark. I actually think I'm going to invest in one this winter too, because I find that that's one of the hardest pieces for me in the morning is getting up when it's so dark in the morning and you just feel a little bit more sluggish, right?
For sure. Absolutely. Yes. For me, it's the morning. And then it's also driving the kids around to their various activities in the pitch black.
Yeah,
Yeah. It's
it's
such
hard.
a shift, right? It's a big adjustment.
Mhm.
So, okay, happy lights. And where would someone find one of these, a happy light, a light therapy lamp, or one of the alarm clocks that you mentioned?
Yeah, there's
Available.
lots of places where you can find them. Amazon has a lot of different options. I mean, places like Walmart have a lot of different options. And so, I mean, you Google it online, you'll find a lot of different options and a lot of different price ranges. The key for the happy light that you're looking at for the light being admitted is a 10,000 lux light. And so that's again where most of the research falls. And so as long as you're kind of finding one in that reference range for the lux, that exposure is what we're looking at for the light.
Okay, very good. So it's different than a regular light. It's much brighter. It's
It
much
is,
stronger. And you
yes.
said about even 20 minutes a day, even just when we're
Yes.
online or at our computer, just kind of having it beside, as simple as that, we could integrate it into our daily
Absolutely.
routine.
Absolutely. And we don't really want to be staring right at it. So kind of having it off to the side is a perfect way to do it. And again, ideally early in the day so that we're getting that light exposure early on.
Beautiful. Okay, wonderful. Well, I think
Mhm.
those are some really practical, I hope really practical, easy to implement tips. What just the little things that we can do, things that even seem very small, integrated or sprinkled through our day here and there can really make a difference in terms of maintaining a good mood and good well-being and contributing to our overall wellness. So I think those
Absolutely.
are wonderful tips. And I know we're running out of time, but just lastly, before we let you go, Dr. Carly, I wanted to ask you if there was sort of one thing, one takeaway message, or one little gem to hold on to that you'd really like all women or all people to know for this time of year, for coping with seasonal mood changes, regardless of severity. What might that be?
Yeah, I think the biggest takeaway for me, Cree, to really just put out there is that we do really want to acknowledge that mental health is as important as physical health, if not more important. And that if you're feeling like something isn't right, that we want to make sure that you are thinking about reaching out and following up and getting care because there are a lot of treatment options out there. In addition to some of these little things we mentioned, I mean, there's lots of great tools with psychotherapy. There's lots of nutrients and herbs and pharmaceuticals that we can pull in as well. And so we don't want to ever leave people feeling like there aren't options or that their mental health doesn't matter, that everybody goes through it. I mean, it is important. We want to make sure that you do have the tools you need to feel great and go through an entire season feeling good as opposed to trying to suffer through it because that's really hard.
Right. We deserve to feel good, right? And
Absolutely.
there's lots of resources and help out there. So reach out, right? We want folks to reach out.
Absolutely.
Thank you. And Carly, if people want to get in touch with you, what's in this busy world? What's the best way to do that? The best way to contact you?
Yeah, so probably through my website is the easiest way to reach me. So it's just www.drcarlykingnd.com. I am also on Instagram. I post a lot of things on there as
Mhm.
well. And so my handle is dr.carlyking.nd there as well if you want to reach out.
Okay, thank you. Thank you. And Carly, just before we go, one of the things that I really love about working with you over the years is that your suggestions, your recommendations, your treatment plans are so practical. And I know anyone out there who has worked with you or follows you like we do on the social media feeds would likely experience that same benefit, that the suggestions are so fine-tuned to our everyday lives. You get it that we're busy working moms and professionals and people. And so those strategies I think that you've shared today and that you generally use in your practice are just really, really practical and a great way that we can stay well and stay feeling great even when it's November and darkness is setting in, at 4:45 or 5 p.m. So a big thank you so much for joining us today. We really appreciate you taking the time to be here, and we wish you a wonderful November and a great upcoming holiday season as well. Thank you so much.
Thank you for having me, Cree.
Bye, Carly.
Take care.